My name is Arthur Hagen. I'm a consulting cardiologist in private practice. I'm a fellow in the American College of Cardiology and spent 24 years in military and academic medicine, during which time I co-authored 130 scientific publications, also authored 12 book chapters and 2 textbooks. Since I resigned my position as chief of cardiology at LDS Hospital and tenured professor of medicine at the University of Utah in Salt Lake City in 1984, I've been in private practice ever since in Oklahoma, with a special focus and interest in primary and secondary prevention. I had been frustrated for many years of not being able to get a significant percentage of my hyperlipidemia patients to treatment goal, as defined by the National Cholesterol Education Program, by using prescription medications, diet, and exercise. In 1997, an internist friend of mine introduced me to BioSlife. After reviewing an extensive amount of medical literature on the health benefits of soluble fiber and completing my own clinical study in 240 patients, I've been personally taking BioSlife and recommending it to my patients ever since. My 3-month follow-up study in the 240 patients with hyperlipidemia, in whom diet, medications, and exercise remained unchanged, demonstrated an average decrease in total cholesterol of 30%. The LDL decreased 26%. The triglycerides dropped an incredible 79%, while the good HDL cholesterol increased an average of 30%. I currently have between 700 and 800 patients taking BioSlife. In addition to hyperlipidemia treatment goals being achieved better with the addition of BioSlife to their medical regimen, it's also very beneficial in controlling blood sugars in diabetics, as well as preventing recurrent hypoglycemia in non-diabetics. When BioSlife is taken properly before each meal, it's a very important adjunct to any dietary program for weight loss. The current NCEP treatment guidelines for all physicians are to recommend soluble fiber to all patients with elevated cholesterol. The only practical way to obtain the proper types of soluble fiber with proven clinical effectiveness is by taking BioSlife.
My name is Dr. Frank L. Murphy. I'm board certified in internal medicine and cardiology and am a clinical professor of medicine at the UCLA School of Medicine. I was the founding director of the UCLA Preventive Health Program, and in that capacity witnessed the clinical trials at Stanford University of a dietary fiber supplement called BioSlife that substantially lowered serum cholesterol. 4 years ago, I discovered that my cholesterol was dangerously high, 350 to be exact, and I was panicked. I began on the product, and after 2 months, my cholesterol had fallen over 150 points to less than 200. I then began trying the product on friends and selected patients and found similar responses, confirming the fact that indeed Unicity had come up with an all-new natural approach to the treatment of elevated serum cholesterol. Likewise, I have also used the Celery Essentials product for 4 years, and given my prior risk factor, I should have coronary disease. Again, my cholesterol before I started the BioSlife and Celery Essentials was 350, now less than 200. Former smoker, genetics very similar to my father who had premature coronary disease. Yet according to an ultra-fast CT scan I had done, my calcium volume score came up 0. This scan is extremely sensitive for coronary disease and shows that I have no evidence of heart disease.
My name is Dr. Dan Nelson. I was head of our cardiology division, one of the 12 largest multi-specialty medical clinics in the United States, for 11 of my 22 years of practice. I am currently a working interventional cardiologist and have been treating patients with angioplasty since the early 1980s. Since then, I have been fortunate to use directional atherectomy, coronary thrombectomy, laser techniques, and rotablator catheters in the ensuing 15 years for both elective and emergent procedures. I have inserted all types of coronary stents as they became available since the early 1990s. These techniques have been premier breakthroughs in the history of medicine for the treatment of our patients. Unfortunately, these gratifying treatments we talk about will in no way prevent the primary problem, which is rampant disease of the body's arteries, an epidemic that is responsible for 50% of the deaths in the United States year after year and is brought on by the inability to control cholesterol in our diets as a major factor. When we talk about alternative and preventive care for our patients, I would confirm to you that physicians in general are quite skeptical of these products, and cardiologists are without a doubt one of the most skeptical groups. However, I was quite intrigued by the initial discussion I heard and in view of my family history of coronary disease, I have since used BioSlife in combination with my current statin drug. I've dropped my total cholesterol to 105, a full 70 points below a respectable level with the statin drug alone, and my bad LDL fraction dropped to 60, 35 points below the previously thought adequate level achieved with the statin drug alone. In addition, my triglycerides dropped 60 points to 50. I was astonished that this great formulation could do this for me and was convinced that it should do the same for many of my patients. It gives me great pleasure to introduce it to my patients, a great many of whom are on fixed or limited incomes with staggering prescription costs for more expensive forms of therapy. Many of them have already experienced great results.
Philip Boudreau here. I'm a University of Minnesota trained transplant surgeon, a professor of surgery, been in practice for over 15 years now, board certified in general surgery and critical care. I was first introduced through the Unicity product line through Rexall about 5 years ago, through my partner and through my wife, who became a independent business owner, and I had a cholesterol challenge and was able to successfully lower my cholesterol 50 points with the BioSlife 2. I was new to the concept of nutraceuticals and alternative health care, but was being somewhat frustrated by some of the things that were happening in the practice where, as you know, I am one of the doctors of the last resort, and that people come to me when it's broke so bad it can't be fixed and needs to be replaced. And so transplanting patients with perfectly good livers or pancreases or kidneys, only to have them succumb a few years later to the same thing we all get, strokes and heart attacks and cancer and other presumably preventable disease. One particular experience that struck me and I guess really made me take a serious look at this method of providing care for patients was when a patient came to me about 7 or 8 years after his combined kidney pancreas transplant. He was about 33 years old, had diabetes and renal failure. He had diabetes since a very early age. He had a successful pancreas and kidney transplant, and then after about 4 or 5 years was seeing other physicians because his health plan changed. He then showed up in my office after a several-year absence and said, "I really would like to see you, even though you're, quote, out of plan." I said, "I'd be happy to see you. I haven't seen you in 3 or 4 years. Tell me what's going on." He was very pale. He had orthostatic hypotension with a blood pressure supine of 170 over 110, and standing his blood pressure was 80 over 40. He had angina walking about 20 feet. He couldn't carry a laundry basket of clothes down the hall in his house, and he would get chest pain going from his car park to his office. He was hospitalized right away and evaluated by cardiology, and to make a short story even shorter, he had non-bypassable, non-correctable coronary artery disease. He also had profound Shaw-Drager syndrome with orthostatic hypotension, and his cardiologist gave him about 6 months. His kidney and pancreas transplants were working fine with normal serum creatinine and normal fasting glucoses and hemoglobin A1C levels. His 42-year-old brother had just died of a heart attack. His 44-year-old brother had just had a 4-vessel bypass. He was 43. And I was recently aware of the BioSlife and a new product called Cellular Essentials, which was designed to reverse coronary artery disease without surgery. And this patient certainly was not a candidate for surgery. He also had a serum cholesterol of 280. And I offered him some BioSlife and Cellular Essentials and said, "Would you be interested in trying something alternative to what you're trying now, since it doesn't seem to be anything that we're doing seems to be working?" By this time, he had been 6 weeks in the hospital, and everything that was given to improve his supine hypertension made him more severely orthostatic and worsened his angina. Anything that was given to improve his orthostasis also worsened his angina. And he went home taking BioSlife 2 and Cellular Essentials, and I was really curious to find out what would happen and whether these products would interact with his immunosuppression, and there was absolutely no reason to suspect there would be any adverse reactions, but still I was a skeptic and uncertain. 6 weeks later, he walked into my office and said, "I'd like to go back to work." I said, "What are you talking about?" He said, "Well, I mowed my grass yesterday. I didn't have any chest pain." His blood pressure, supine and standing, was 120 over 80. His cholesterol had decreased to 180, with no change in his diet and on no lipid-lowering agents. So we let him go back to work. About 3 months went by, and I couldn't get him back into the office until after consistent badgering. I knew he was still thriving. I would get his twice-monthly showing everything was in good working order, but I couldn't get him back in the office. Finally got him back in the office at the end of the summer and sort of read him the riot act for asking where he was all summer, and he said, well, I just came off of 109 days straight of 12-hour shifts. He worked at a plant as an engineer, and we had a big plant turnaround, and I couldn't leave. Now, this was a man who 6 weeks previously was sent home to die and was now working 12-hour shifts without chest pain. His dobutamine stress echo, which had showed about a 10 to 15% ejection fraction, now had about a 45% ejection fraction, and a lot of his hypokinetic portions of his heart were now beating vigorously. And this, I guess everyone has a seminal event that sort of convinces them that this is definitely worth a second look, and I guess that was my defining moment. I encourage you to look seriously at this project and seriously consider what benefits these products may have for you personally and in your family members and people you care about, as well as your patients. Thank you.
My name is Chet Gentry. I'm a board-certified fellow of the American Academy of Family Physicians. I went to medical school at Michigan State University and began my family practice residency at the University of Virginia in Charlottesville and completed my residency at Roanoke Memorial Hospital System in Roanoke, Virginia. I have a large population of diabetic patients who are treated through a comprehensive disease management system. Our practice participates in a national research network which extracts information and compares outcomes data with other practices based on clinical performance measures such as cholesterol and A1C levels. In 1998, our practice received the Best Practice Award for diabetes. I recommend BioSlifer as part of our nutritional component and have seen impressive reductions in total cholesterol, triglycerides, and LDL levels, decreased medication requirements, and in some cases we have avoided the need for insulin injections. In combination with lifestyle changes in diet and exercise with newly diagnosed diabetics, I have seen BioSlife contribute to greater than 100-point drops in triglycerides and 20-point drops in total cholesterol and LDL. In cases where BioSlife was the only significant variable change, I have come to expect a change in lipid profiles similar to what we would see with the addition of Lescol, a commonly used anti-cholesterol drug in the statin family. I have seen several additional results with BioSlife. Symptoms of gastroesophageal reflux are reduced. The incidence of constipation and subsequent hemorrhoids are reduced, and postprandial spikes in blood sugar are reduced. In light of the cholesterol and glucose-lowering benefits of BioSlife, combined with the numerous other known health benefits of fiber, particularly the blend of fibers used in BioSlife, the recommendation of this product to my patients is a no-brainer. I have had patients stop taking the fiber, thus requiring increased doses of diabetic and cholesterol-lowering medication. After experiencing the side effect of the medications, including muscle pain, weakness, or elevation of liver enzymes, many of the patients who stopped taking the fiber return requesting to start back on BioSlife.
Hello, I'm Dr. Stuart Lonke, board certified in internal medicine, pulmonary medicine, and critical care medicine. I completed my internal medicine training in New York and at Barnes Hospital in St. Louis, and then I completed my pulmonary fellowship at UC San Diego as a National Institutes of Health Fellow. After 10 years on the faculty there, I entered private practice. Now, my experience with Unicity's product began a little over 4 years ago when a trusted colleague introduced me to BioSlife 2. With a cholesterol over 250, I needed something, and I was very reluctant to make that something a pharmaceutical product. 6 months later, on BioSlife, my cholesterol was under 170. I felt great, and I'd lost about 30 pounds. Needless to say, I made it my point to recommend this product to all people with elevated cholesterol levels and with challenges with blood sugar control who preferred a non-pharmacologic approach to their problem. But it isn't just BioSlife that's impressed me. You see, Unicity is a unique company in the nutritional industry. It's become the industry standard in scientifically based nutritional companies, with 2 products listed in the physician's desk reference. One is the BioSlife I already mentioned, and the other is a remarkable product called Cardio Essentials. Now, this all-natural product, with a per-dose concentration of coenzyme Q10 that's a multiple of that contained in other products on the market, has been formulated with nutritionals like L-carnitine and taurine to support healthy heart muscle. I was intrigued with this product when I heard about it and its potential to support heart function. And I can now say that I've had the occasion to use this product on 2 patients with severe heart failure, both of whom were awaiting heart transplantation. Now, the first fellow was 50 when I started him on this product, and he had an ejection fraction of under 15% on 2 successive echocardiograms. He was on the list for a transplant and was actually able to stay out of the hospital for a total of 12 weeks while he waited for his donor heart. His response was a modest increase of his ejection fraction to just over 20%, but he remained functionally stable at home until his transplant 4 months ago. Now, the second case is actually far more dramatic. This 52-year-old gentleman has been my patient for a little over a year. His heart function deteriorated from a combination of atherosclerosis and hypertension to an ejection fraction of also just under 15%. His legs were swollen. He had fluid in his lungs. We tried 2 different approaches to treatment, both of them using drug therapy under the guidance of a team of heart specialists. Both failed. The ejection fraction on 3 different occasions, about 6 weeks apart, was still 15%. Well, as a last resort, the cardiologist gave his okay to a trial of Cardio Essentials, and I am very happy to say that 5 months later, this man currently has an ejection fraction of over 30%, a doubling, and we've measured it twice. Now, he's decided to hold off on a transplant. He's still on the list, but he's actually bypassed 1 donor heart. His legs are now not swollen, and he's now responding to diuretics. He's actually begun getting out of the house again and beginning to socialize. Now, I know you'll admit these are amazing results. I know that. But they weren't unexpected. It's what I've come to expect from a company that does all the work before it releases its products. It's why I never hesitate to promote and personally use Unicity Nutritionals.
I am Dr. Sylvester Domming. I graduated from the University of Kansas School of Medicine. I have completed 4 years of postdoctorate education, and I am board certified in family medicine and am a fellow of the American Academy of Family Practice. I am also a fellow of the Association of Emergency Physicians. I own and operate Midwest Emergency Physicians, and I am an assistant professor of medicine at the medical school. I also am director of a family medicine training program where we actively are training 50 residents to become board certified in family medicine. I am a big advocate of BioSlife and the tremendous impact that it has on positively impacting one's health in the prevention of heart disease and cancer. My father died of colon cancer, so that is a major issue for me. It has put me in control to lower my risk for this terrible disease. I have also lowered my total cholesterol by over 65 points since starting BioSlife, and I have painlessly lost 25 pounds. I had a heart scan this past year, and it revealed absolutely no detectable lesions whatsoever. I have had the great pleasure to see many lower their cholesterol and concomitantly lower their risk for coronary disease by sharing the good word about BioSlife 2. BIOS is the world's #1 viscous fiber supplement, and it fulfills the requirements for the NCEP guidelines for treating high cholesterol without using medication that would have potentially devastating side effects. We are all too aware that the 4th leading cause of death in the United States is from side effects of prescription drugs that are both prescribed and taken properly. I never start my day without BioSlife.
My name is Dr. Stephen Bloom. I have been in the practice of family medicine for more than 20 years in Boca Raton, Florida. I utilized the BioSlife in my practice for several years, having numerous positive responses with type 2 diabetic patients, helping them to reduce their oral medications, and even getting some patients off their oral medications permanently. Even more impressively, I witnessed lipid levels lowering dramatically. Personally, it has been an interesting experience as I have utilized BioSlife as an adjunct therapy for myself. I had a total cholesterol of nearly 400. I started with Mevacor, later switched to Zocor, then switched to Lipitor. Although they lowered my cholesterol, I did experience some side effects with each drug. Although my personal results using BIOS Life were acceptable, my main motivation to continue the BIOS Life was due to the findings of a Harvard University study which incorporated over 40,000 participants. They increased their fiber intake to 30 grams daily, which is almost impossible without supplementation, and they reduced their coronary risk factors by 30%. When the upgrade to BIOS Life was presented to me, I implemented it immediately, and to my astonishment, in just 2 weeks, I had an LDL drop of 20 points, something I was unable to accomplish in the history of treating my elevated cholesterol with statin medications. There is no doubt this formulation should be used as a primary approach to the treatment of hyperlipidemia, as well as be presented to diabetics. There is just no point in jumping to the statins if this option exists.